Assalamu alaikum everyone. I am Abid Hussain, final year student of Doctor of Veterinary Medicine at UVas Lahore. Today we are discussing the case of uterine T-cell lymphoma in a 6-year-old Irish wolfhound. There was a female intact dog of 6 years old, weighing 57.7 kg and with a history of previous mild vulvovaginitis 2 times. And they performed artificial insemination several times, and the history of that dog whelped in 2007, and after whelping, mild valvular swelling and minimal discharge was came from vagina, and that was indicating the sign of heat. And they performed multiple artificial insemination attempts, 3 times total, and every time the repeated negative pregnancy tests were came. And for vaginitis, they treat the dog with cephalexin 1 gram per oral 12 hours for 10 days. And other health issues were aspiration pneumonia, skin lesions, and low serum thyroxine. Now, if we talk about the clinical signs and gross findings of that dog became lethargic, weak, and anorexic, and there was also sign of vomiting, and died within 2 weeks after onset of those signs. And the gross necropsy was the uterus of the dog markedly thickened and ovaries become bilaterally enlarged, and multiple pale nodules on the kidneys and spleen, and renal lesions with necrotic centers, and also the subcutaneous calcinosis. So they performed a microbiological test and some lab tests that was showing vaginal culture results. They're showing a beta hemolytic streptococcus species and Escherichia coli and coagulase positive staphylococcus species. And for those, the treatment was done by the cephalexin 1 gram per oral 12 hour for 10 days. And some other necropsy findings also showing necrohemorrhagic lesion in the spleen with fibrosis. So for that case, they performed histopathology, and the histopathological findings showing round central tumor infiltrating uterus transmurally, and replaced a normal myometrium structure, and some neoplastic cells infiltrated both ovaries. And the cell morphology of those tumor cells was round nuclei, hyperchromatic, and moderate anisocytosis and anisokaryosis. And they performed immunohistochemical stainings for CD3 and CD20, and CD3 that was showing strong positive results for T cell origin, and CD20 showing negative results for B cell lymphoma. So the final diagnosis after performing those microbiological tests and histopathology, the final diagnosis was primary uterine T-cell lymphoma with bilateral ovarian invasion. And now if we discuss the key discussion points, the uterine T-cell lymphoma is very rare tumor in female dogs, and usually lymphomas in dogs are multicentric, not reproductive, and uterine lymphoma extremely uncommon. Few cases are reported. So chronic reproductive tract inflammation may play a role in this, and repeated uterine manipulation AI may contribute to this because they done multiple times artificial insemination for that dog, because there was vaginal discharge that was coming from the vagina, and that was indicating the sign of heat, and for that they perform artificial insemination multiple times, and repeated uterine manipulation may contribute for the tumorous cells. And This case of uterine T-cell lymphoma might be considered in infertility, should be considered in infertility with thickened uterine wall. Thank you for listening, and if you have any questions, you can ask me.